Okay, today we will see how do we measure the length and width for placement of implant. It is very easy though. We are opening one CBCT. I think she is a case of full mouth rehabilitation. She has severe periodontal bone loss. I have marked one side mandibular nerve just to show you how we do the marking. I have drawn the curve also. So if it is anterior teeth, this is the tool for measurement. This way we measure the width, the length, and then just drag the measurements to separate and see it more properly. For the nerve, we stop the length just 2 mm before the nerve starts. It is different for everyone, but 2 to 3 mm is good enough. This is how we measure in the mandibular posterior region and maxillary. As you can see, there is almost no bone left. So this is how we do it. Since there is no cortical bone on the palatal side, just on the buccal side, palatal side, you can see it is deficient. So we will just start from wherever it is. We will skip this area of cortical bone because it doesn't have an opposing one. For the anterior, we do it this way. We keep the angle of the longitudinal measurement as per the angle of the tooth or in the center of the buccal and the palatal plate of bone. And then for pterygoid region, we go backward. And this is how I have already measured. Sometimes if we place the pterygoid implant a little tilted posteriorly, so what we can do is, I have drawn a curve here. We tilt the longitudinal section since we don't put the implant straight. So sometimes when it is single tooth, we just tilt the longitudinal section and then do the measurement. Like for example, for pterygoid, if you want to do, I'm selecting this curve and then I'll just tilt this a little bit and then we can measure it, measure the pterygoid plate, pterygoid bone, so like this. Now it is measured like this, the way a dentist, the surgeon or the dentist puts the implant, it is angled that way, the sections. But even if you draw it on a straight, it doesn't make that much of a difference. But sometimes, yes, if it is very deficient bone and you don't want to take any chance, you can change the angle just to be sure. Thank you. If you have any doubt in this, you can ask me later.